Good afternoon, everyone. I wanted to welcome everyone to today's webinar entitled Understanding the Opioid Crisis in the U.S. Latino Population. My name is Maxine Henry, the co-director for the National Hispanic and Latino Addiction Technology Transfer Center. I will be your host for today's webinar. Before I introduce you to today's guest presenter, here are some brief instructions about today's webinar. Linda, may I please have the next slide? Thank you. This webinar will be recorded and archived for future playback. It will also be dubbed or closed captioned in Spanish and eventually also in Portuguese. A copy of today's presentation will also be made available after the webinar. The lines will be muted throughout the presentation so as to minimize background noise and other interference. We will hold the Q&A portion at the end of our webinar. At that time, you will have an opportunity to ask questions by clicking the Raise Your Hand button on the bottom right-hand corner of the screen, or you can use the Q&A box in the center bottom of your screen. In that way, we will present your questions to our presenter. We will also be asking you to fill out a brief survey at the end of this webinar. The satisfaction evaluation is important to the work we do and provides us the opportunity to improve our training efforts. You will be redirected to this satisfaction survey immediately at the end of this webinar. Although we did not secure continuing education credits for this event, we plan to do so for future events. So let us begin. Linda, may I please have the next slide? Great. Let us start by introducing the National Hispanic and Latino Addiction Technology Transfer Center, or ATTC, and our team. The National Hispanic and Latino ATTC is housed at the National Latino Behavioral Health Association, located in New Mexico. NALBA was established to fill a need for a unified national voice for Latino populations in the behavioral health arena, and to bring attention to the great disparities that exist in areas of access, utilization, practice-based research, and adequately trained personnel. NALBA's executive director is Fred Sandoval. Our ATTC is a part of the ATTC network, which is an international multidisciplinary resource for professionals in the addictions treatment and recovery services field. Established in 1993 by the Substance Abuse and Mental Health Services Administration, or SAMHSA, the ATTC network is comprised of 10 domestic regional centers, 6 international HIV centers, which is funded by PEP-FAR, 2 national focus area centers, and a network coordinating office. Together, the network serves the 50 U.S. states, the District of Columbia, Puerto Rico, the U.S. Virgin Islands, and the Pacific Islands of Guam, America Samoa, Palau, the Marshall Islands, Micronesia, and the Marina Islands. The international HIV ATTCs serve Vietnam, Southeast Asia, South Africa, and Ukraine. Here, you will see a map of the U.S.-based ATTCs. The National Hispanic and Latino ATTC has a national focus for Hispanic and Latino communities and the workforce that provides services to these communities. Our ATTC is staffed by Dr. Pierre Luigi Mancini, our program director, and myself, Maxine Henry, the program co-director. Linda, may I please have the next slide? So this is a picture of Pierre Luigi Mancini and myself. The National Latino Behavioral Health Association is also the home of our sister TTC, the National Hispanic and Latino Prevention Technology Transfer Center. We will provide contact information at the end of this webinar. Our esteemed presenter for today is Dr. Linda M. Callejas. She is a social cultural anthropologist with expertise in qualitative methodologies and community-engaged research. She conducts research and evaluation in the areas of behavioral health disparities, innovative practices and interventions designed to increase engagement among critically underserved populations, and collaborative community initiatives designed to improve health and well-being. Dr. Callejas is especially interested in understanding how aspects of the social environment in urban neighborhoods affect residents' mental health and well-being, particularly in cities experiencing large-scale redevelopment. She has also done extensive work studying how community residents work within their neighborhoods to provide support and assistance to their neighbors in marginalized communities. Aside from research, her activities in this area include consultation to community-based organizations, evaluation, and training and support for a variety of community support programs that include natural helpers, peer specialists, and promotores. Dr. Callejas has served as principal investigator, or PI, on a number of research and evaluation projects. She currently serves as the PI for 2 evaluation projects, which include a randomized controlled trial designed to test an intervention designed to help substance misusing parents who reside in Miami-Dade County, Florida, and are receiving intensive child welfare services to maintain their parental rights. In addition, Dr. Callejas serves as director of the Cultural and Linguistic Competence Team of the Technical Assistance Network for Children's Behavioral Health, TA Network, the National Center for States and Communities funded by SAMHSA's Comprehensive Community Mental Health Services for Children and Their Families program, otherwise known as CMHI. In this role, she leads a team that provides technical assistance, training, and support to CMHI grantees in a number of areas to support culturally competent service delivery and promote behavioral health equity for racially and ethnically diverse populations and LGBTQI+ communities around the country. Dr. Callejas, we want to thank you for your work and for being willing to participate in this first webinar for the ATTC and to be our esteemed presenter. So if you would like to start your presentation now.
Well, thank you, Maxine. Thanks very much for that introduction. And thank you, everyone, for joining us today. Before I jump into the webinar, I'd just like to give an overview. I'll be presenting through this presentation some of the most salient issues related to what we know about the effects of the opioid crisis within the U.S. Latino population. And so during the webinar, I'll review trends in opioid use and overdose mortality, what we know about risk factors associated with opioid misuse and overdose in the population, and some evidence-informed and culturally competent strategies to prevent and treat opioid misuse, including some information on practices designed to address the cultural and linguistic needs of Latino individuals and communities suffering the negative effects of the opioid crisis. Throughout, I take a health equity focus to highlight social determinants, including poverty and discrimination, that can increase the risk of opioid use, dependence, and overdose. So this first slide, I asked the question, what is the opioid epidemic? What do we mean by that, or the opioid crisis? This crisis in the United States is characterized by a sharp rise in the use of opioids, particularly prescribed medications, and a concomitant rise in overdose-related deaths. And this public health crisis has affected a vast number of families and communities throughout the country, resulting in some of the figures you see here on this slide. It's garnered, national attention, as well as state-level attention, and particular attention from behavioral health organizations, medical professionals, all working together to combat opioid misuse and related deaths. And overall, this population, especially in the popular media, recent attention has been focused on non-Latino white populations, generally speaking. So we want to take the opportunity to highlight how this crisis is affecting other communities. But very generally speaking, as you see, 130 individuals die in this country every day from opioid overdose, and the CDC estimates $78.5 billion a year are spent to address the costs of this crisis through healthcare, lost productivity, substance use treatment costs, as well as criminal justice involvement. So what caused this crisis? Essentially, the crisis that we're currently experiencing emerged following a period in the 1990s that included a sharp rise in opioid prescriptions, leading to broad misuse of these drugs and alarming increases in overdose-related deaths. The CDC characterizes these factors creating or leading to the crisis as having occurred in 3 successive waves, shown here, right? So in 1990, about there, you start to see increases in the prescribing of particularly opioid medications for pain management, and then you start to see increasing use of these, leading to misuse. Then in 2010, what they characterize as a second wave is when we start to see heroin overdose deaths that start to compound what's been happening since the 1990s. And then in 2013, we start to see significant increases in overdose deaths due to use of synthetic opioids, particularly illicitly manufactured fentanyl. So fentanyl that's been manufactured not for medical uses. So just a quick overview of the Latino population in the United States. As many of you probably know, this is the largest of our country's racial ethnic populations, with a majority of Latinos being born in this country. In addition, Latinos are the nation's second fastest growing racial ethnic group. And if the current growth rate holds, by 2050, about 31% of all children in this country will be Latino. There's a very diverse population. Latinos can be of any race, and there can be diversity around a whole host of categories, including primary language spoken, not just English and Spanish, but a number of different indigenous languages, country of origin, ties to that country of origin, years of settlement in the US, religious beliefs, educational attainment, and socioeconomic status. And this category that we're referring to today is inclusive of all persons of Mexican, Puerto Rican, South or Central American descent, or those from other countries or territories with primary historic ties to Spain. Latinos are also the youngest racial ethnic group in this country. And as you see, about a third of the population that's under 18 is under 18 years of age. And the majority, just almost all of them, 95%, are US born, although half of these youth currently live within immigrant families. The number of Latino children has increased sharply since 2000. And we've seen some strides with regards to high school graduation rates and educational attainment in particular, which folks have been working on quite a bit in the past decade. However, we do continue to see some disparities with regards to incarceration rates, for instance, where Latino youth are more likely to be incarcerated than when compared to non-Latino white youth. So moving on to opioid use among US Latinos, trends in national surveys of substance use generally find rates of opioid use in Latinos that are very similar to those of whites and just slightly lower than those of Blacks. So they're really on par with these two groups. But between 2005 and 2011, Latinos accounted for about 11% of all emergency room visits that were initiated because of substance use. And heroin was identified as the major substance of misuse in about 27% of those visits. Identification of prescription opioids as the main substance causing an ER visit increases in 2009 for Latinos, and while heroin as the main substance initiating a visit begins to drop in 2010. A study with a large and geographically diverse sample of opioid-dependent adults found that Latinos in treatment had higher levels of risky injection drug use as compared to non-Latino whites and Blacks. In addition, these individuals tend to be younger, had lower rates of educational attainment, and lived in larger metropolitan areas when compared to heroin users from other racial backgrounds. Studies also find reported use of heroin in the past year increased among Latinos that use prescription opioids between 2008 and 2011, which is concerning because it suggests that folks that are been using prescription opioids went ahead and started to try heroin. The primary substances used by Latinos vary by subgroup and by geographic region, and there are not a whole lot of data around these areas. However, if we look at substance use treatment data, admissions data, we can start to put a picture together. And we see from looking at admissions to substance use treatment facilities, which are reported by all states to the federal government in 2015, these are some of the differences that we saw based on the groups or the subgroups within Latinos that they collected data for. So as you can see here, heroin was most often identified as the primary substance of use by Puerto Rican descent males and females at admission. And you see the rates, nearly half of the Puerto Rican descent males that came into substance use treatments facilities reported using heroin as their primary substance of use. And you have a pretty high rate for females as well. On the flip side there, you see that prescription opioids by this subgroup was reported as being very low. Now compare that to Mexican descent individuals, male and female, and the rate is much lower. So 18% of Mexican descent males and 15% of Mexican descent females identified heroin as their primary substance of use. And actually neither males nor females of Mexican descent identified prescription opioids in that time period, in that year, as a primary substance of use. Excuse me, I wanted to finish one thought there. I just wanted to add here that speaking of geographic differences related to opioid use and mortality, a number of communities in the U.S. Southwest and Northeast have experienced high rates of Latino heroin dependence and overdose fatalities since the 1960s. So that experience, that historical experience with high rates of heroin use and overdose are believed to have set the stage for some of the more recent increases in opioid use and overdose that we've seen among Latinos in these regions. A number of states in these regions have in essence experienced an opioid crisis in the past as a result. And despite a number of differences in, between the Southwest and Northeast states, including, with the drug routes that are used to bring heroin in, the type of heroin that's available, and ethnic differences in these states, poverty and limited economic opportunities help to keep heroin dependence pretty entrenched in these areas. So it's important to recognize that, I think, because it's a social factor that contributes to this crisis, especially in these states that are experiencing, some of which are experiencing very high rates of overdose. So in these regions of the country, cheap and more readily available heroin is thought to be increasing among prescription opioid users, because they can, once they no longer afford them, they can find ready access to cheaper heroin. So moving to looking at Latino youth and young adults and their opioid use in general, more recent national surveys with adolescents suggest that substance use in general and opioid misuse in particular is increasing among Latinos. So for instance, the most recent Monitoring the Future survey shows that Hispanic and Latino eighth graders reported the highest rates of use for nearly all classes of drugs when compared with white and Black students, and that includes opioids. And among 12th graders, we see the highest use rates for a number of substances, including oxycodone and the other drugs shown here. The National Youth Risk Behavior Surveillance Survey also found increases in opioid use among Latino students in grades 9 to 12. Latino male students reported higher rates of ever having used heroin than non-Latino white males, and were second only to Black male students with regards to prevalence of ever having injected any illegal drug. In addition, the prevalence of ever having taken prescription pain medicine, including oxycodone again, or hydrocodone, without a prescription, or misuse in the sense that you're not using it for a prescribed purpose, was generally higher among Latinas than among non-Latina and Black female students. So these trends in opioid use among Latino youth raise concern about increased risk of opioid dependence, not only in younger cohorts, but in the future, right? And what these younger cohorts are going to be experiencing in the future, particularly since research and some of the studies we just mentioned show that recreational use of prescription opioids in adolescents predict future heroin initiation. And that's found across ethnic groups. And just one quick note about some subgroups among youth and young adults that are also worth taking a look at. Pregnant Latina adolescents and young Latina mothers are also a subgroup in this population that there's some figures on. Between 2007 and 2010, for instance, Latinas comprised about 19% of pregnant youth aged 12 to 19 that were admitted annually to substance use treatment facilities. And there's not a lot of data that's specific to those young women, but opioids were identified as the drug of choice at about 6% for heroin and 9% for other opioids for all the youth admitted. So we don't know exactly the use rate there, but it's something to consider given that this is a vulnerable population. And so treatment providers in states with higher rates of overdose fatalities in particular have begun to focus on, how to increase awareness in young Latina and other mothers of other cultural backgrounds in particular, to have them engage in medication-assisted treatments, which we'll talk a little bit about in just a bit, and engage them in comprehensive services to sort of prevent not just their ongoing dependence, but that harm done to their babies and also possible subsequent removal into child welfare. So as many have noted, rising opioid-related mortality has reversed decades of reductions in the national mortality rate. Opioid-related deaths have increased among many segments of the national population and in subgroups, including Latinos, which saw an increase in the mortality rate by about 1.5% for those aged 15 and older. The age-adjusted opioid-related death rate for U.S. Latinos was 6.8 deaths per 100,000 in 2017. And that's that bottom or line that you see on this slide. And the states that are included here, there were probably at least 5 more states that have higher rates of overdose mortality in Latinos. But I included these because these were more than double the rate. The highest rate, it's about 28 per 100,000 deaths, is in Massachusetts, which is that blue line at the top. The second, followed by, I believe that's Ohio, which is actually a new, if you compare that to the 2016, Ohio's rate was much, you can see the jump that Ohio made with regards to the death rate among Latinos, and then followed by Connecticut, which is pretty similar to 2016. And the graph shown here, just for some more information, was generated by the Kaiser Family Foundation's website. They maintain a state health facts website with specific data on a number of indicators, including opioid overdose deaths by race, ethnicity. The site uses the CDC's National Center for Health Statistics data on multiple cause of death. And you can track these indicators from 1999 through 2017, and it's a good resource for generating data specific to states on various indicators related to overdose mortality. So given the increases in opioid use and mortality among Latinos, it's important to understand some of the pathways or factors that contribute to non-medical and illicit opioid use, as well as some of the issues that affect how well Latino individuals can access services and treatments. So the next few slides will start to outline some of these factors that are believed to help increase the risk of substance use in general, opioid dependence, and or overdose in Latinos. The social factors of key importance with regards to substance use, among them listed here, studies consistently show that self-reports of discrimination are associated with increases in recreational substance use among Latino adults aged 18 to 72, regardless of gender. And research also shows that conflict within the family, related in particular to a culture of stress, that is when there are different levels of immigration status, for instance, especially when you have Latino youth who are born here or grow up here from a very young age, and the parents are immigrants, you tend to see increased risk of substance misuse, in particular when there's a lot of family stress and conflict. And another issue is that adult Latino immigrants may be less willing to seek out treatment needed to that they need due to fear of deportation or discrimination, which places them, if they're dependent on opioids, at greater risk of overdose in the future. And these findings highlight the importance of recognizing how social factors, including discrimination, related to not just the ethnic identity, but immigration status or socioeconomic status can increase, help to increase the risk of opioid misuse, substance use in general, and underutilization of needed services in the population. With regards to pain management, it's clear that more research is needed on the use of opioid pain medications by Latinos with chronic pain, and that includes U.S. veterans. But a national study examining chronic pain in workers, for instance, found that Mexican Americans may be at an increased risk for experiencing injury and chronic pain because of their occupational exposure. And in addition, Latinos experience disparities in access to opioid medications for severe pain. So a community study, for instance, found that Latino residents of low-income neighborhoods are significantly less likely to receive an opioid prescription than are their non-Latino white counterparts, despite reporting similar levels of pain and pain severity to doctors. And further, and this is concerning, right? Even when individuals do receive prescriptions, the pharmacies in the neighborhoods where they reside may not carry them. So another issue associated, another social issue or factor associated with opioid use in Latinos is that it's more likely to be criminalized when it's done on the part of Latinos, and they're resulting in higher rates of incarceration as compared to non-Latino whites. However, they're less likely, once incarcerated especially, they're less likely to be offered substance use treatment or be referred for programs designed to reduce the likelihood of overdose or transmission of infectious diseases associated with opioid use while in jail or prison. And national surveys suggest that in general, when opioid use disorders remain largely untreated, especially in criminal justice settings, that use often resumes after the person is released, right? So this can lead to relapse, fatal overdose in the future, increases in the spread of opioid-associated infections like HIV or hepatitis, and obviously reincarceration. So now turning to issues in access to and use of needed services and treatment. Latinos are less likely to seek and complete substance use treatment, remain in treatment for shorter periods. They generally tend to receive fewer services and are less likely to report satisfaction with treatment when compared to their white counterparts. And that's based on a number of studies. However, they do tend to have positive outcomes when receiving quality treatment services. However, increased unemployment and housing instability have been found to lower rates of treatment completion. So those are two key underlying factors that can, create barriers to adhering to and fully completing treatment modalities. And access and utilization barriers that are experienced by Latinos are often exacerbated by a shortage of behavioral health practitioners and treatment providers who are culturally responsive to the cultural and linguistic needs of the population. And findings, for instance, of an international study with a diverse sample of Latinos identified some barriers to the use of behavioral health services in general. These were wanting to deal with problems on their own, beliefs that treatment would not work, uncertainty about where to go or who to see, and fear of being hospitalized against their will. And in addition, barriers to treatment may also differ depending on the geographic area of residence, immigration status, and the degree of acculturation. So medication-assisted treatments for opioid use disorders, which combines medications and psychosocial therapies, are considered to be the evidence-based approach to treatment for these disorders, for opioid dependence and opioid misuse. So medications listed here are those most often used or recommended. And I'm just go through some of the issues we have found with regards to Latinos who are opioid dependent, especially and experience barriers to some of these. Because although there have been great strides and efforts made to make these medications more widely available. The barriers that Latinos experience limit their access to these treatments. And it's important for states and localities in particular to identify these barriers leading to the underutilization of MATs by Latinos and other cultural groups in order to support the development of strategies that can increase engagement and access and adherence to prescribed medication schedules. So buprenorphine, which has been approved for use since 2002 by a number of different types of practitioners in a variety of settings, and is currently available for use either on its own or in combination with other medications. Especially when used in combination, it's really considered to be a best practice treatment, right? But research shows that Latinos are less likely to access buprenorphine, especially. And for instance, a study of injection drug users seeking treatment in Massachusetts found that Latinos and African Americans were more likely to rely only on detox or detoxification treatment than were their white counterparts who had more access to buprenorphine. And some of that reduced access is thought to be because of where where buprenorphine is, the facilities that make it available, they may not be, widely available in certain neighborhoods, and or lack of knowledge about where these treatment options are. There are a whole host of reasons for these barriers. And studies continue to show that these barriers are particularly higher for Latinos who inject heroin and live in urban areas. Adolescents that are using opioids are less likely to receive the buprenorphine in combination with other medications, even though this is considered to be a best practice for early intervention in particular, and you would want that with adolescents. But there can also be barriers because providers are just not making these referrals for different reasons, and there's more research needed in that area. So improved access, though, to buprenorphine in particular has been demonstrated in studies that focus on tailored screening and engagement strategies for heroin injecting patients presenting at emergency rooms with an overdose issue, right? So this strategy has studies shown that this strategy can lead to increased engagement in treatment and reduced heroin use with follow-up engagement in primary care. So it's really important to make that effort with regards to engaging populations in these best practices. Moving on to methadone, although methadone's been available in this country for quite a long time and has really been considered among the most effective treatments for heroin addiction, studies suggest that there is some stigma associated with the use of methadone as a treatment, which can increase dropout and relapse rates. Use of methadone has been found to be stigmatized for a number of reasons, including the geographic distribution of methadone clinics, primarily in poor urban neighborhoods, and negative public perceptions about methadone use. In a survey conducted at a New York City methadone clinic serving high rates of Latinos in recovery, found actually negative attitudes related to this treatment in a majority of the patients, even though those patients were actually doing quite well in their recovery because of the methadone, as well as in clinic staff who expressed negative attitudes and perceptions about people who use methadone and the use of methadone in and of itself, which is, concerning. Because they're administering the treatment. So you want to have wider awareness on the part of those folks that are going to be receiving these treatments, as well as the staff, to really understand what the benefits are, and try to address some of that stigma. And now moving on to naloxone. Naloxone has been federally approved to reverse the effects of opioid overdose via injection or intranasal spray. And federal and state policymakers have recommended wider availability of naloxone in communities with high rates of opioid use, including administration by a wide array of health professionals, first responders, overdose survivors, and their family members. So there's really been a push to make naloxone widely available around the country. And a study done on a brief overdose education up to folks being trained on the use of naloxone has been found to, or shown to be helpful and to significantly increase accurate recognition among heroin users of opioid overdose, of when an overdose is taking place, so that they can act and to accurately identify situations that warrant administration of naloxone. Another study conducted in Massachusetts by the Department of Public Health found that family members can be successfully engaged and trained in community-based programs to prevent fatalities, and a number of practitioners across the country in various states and communities are focused on training Latino family and community members on administration of naloxone in Spanish in particular, to increase the reach of this life-saving medication. So as we move towards the end of the presentation, it's important to discuss some strategies for increasing engagement in and in the use of services and treatments. Few substance abuse prevention programs and treatment interventions have been developed specifically for Latino populations. So adaptation of evidence-based interventions and programs to meet the cultural and linguistic needs and the local conditions of Latinos, depending on where they live and how they live, are critically important, including the use of culturally and linguistically appropriate screening instruments, which is a gap that we see in communities with regards to the screening for substance use treatment. In addition, it's really important for providers to recognize the diversity of this population, especially as it relates to opioid use, and to really avoid group stereotypes or blaming cultural beliefs or practices for the underutilization of treatment among Latino opioid users, because there are a number, as I mentioned earlier, of social factors that play into this underutilization. So this, I just want to call attention to that second bullet. There are some states and Medicaid managed care plans that are moving towards increasing their coverage to include, innovative practices and, in this case, traditional healing practices such as curanderos, to support engagement to treatment. So really doing a lot there to focus on how to support providers and behavioral health treatment providers and other folks who are really working hard, who really need that funding to be able to really make use of these practices. And this is one example of how some states have worked to really improve in this area. A number of Latino cultural values and practices have been identified as protective factors against stress and risky behaviors, including substance use. So probably the most widely recognized, or among the most widely recognized, is familismo, which emphasizes the importance of internal family dynamics, extended social networks, and the distribution of resources through these networks. And in general, research has found strong evidence to support the use of therapies and interventions that incorporate family systems, theoretical models in combating substance use, as well as the involvement of family members throughout the treatment continuum, from engagement through aftercare. So given the powerful protective role that the family appears to play in many Latino populations, and not everyone, but in many, continued improvement and use of family-focused treatment models with diverse subgroups is recommended. And practices or strategies such as home visits, mobile treatment options, and use of trained community members such as promotores de salud and peer specialists have been recommended as a means to make service delivery more responsive to Latinos and other underserved populations. Opioid prescription guidelines were issued by the CDC in 2016 to help stem the alarming increases in opioid misuse and overdose in the general population. And adherence to these guidelines appears to have resulted in decreased prescribing of opioid pain medications by physicians, although excuse me, the amount of opioids prescribed in 2015 is still nearly 3 times as high as the amount prescribed in 1999. So healthcare professionals in particular who serve Latinos should really have up-to-date knowledge related to these guidelines and best practices for safely addressing pain management, screening, etc. As noted earlier, behavioral health systems and substance use providers in particularly should work to reduce barriers to access and increase use of quality services and MATs to effectively respond to this, what we're seeing in terms of growing opioid use and mortality among Latinos. Primary care providers play an important role in prevention of opioid dependence in their Latino patients. And as an important first step, they should, again, screen for opioid misuse and identify substance use disorders during regular visits to help folks, open up to them. We tend to see in the literature that primary care providers are very are trusted professionals, and that they have some success with regards to asking about opioid dependence and talking about treatment options. So PCPs should, can seek training on best practices that are available in these different areas with regards to safely addressing pain management, screening for opioid use, and discussing treatment options. And they should also, as we said, stay abreast of the prescribing guidelines. And finally, treatment providers should remain mindful, again, of the barriers to engagement. They should identify them whenever possible and then remain mindful of them and work to combat them. And some of the ways to do that are listed here by especially thoroughly explaining medications and programs that are being recommended, using all of the available evidence about safety in particular and its effectiveness. And we see that folks will go into treatment when they're given the information about how it will help them. Again, the importance I want to emphasize before I close, engaging family members, including multiple generations or extended family members where appropriate, whenever possible, and the importance of adapting interventions and treatment modalities to ensure that they are responsive to the cultural and linguistic needs of Latinos is critically important. So I will close there and turn it back over to Maxine and see if there are any questions or comments that attendees would like to make.
Thank you so much, Dr. Callejas. That was some amazing information, and I know that we could probably talk for many more hours about the importance of all of this information. So you do have quite a few questions. I want to remind the entire group that we might go a few minutes over the 1 hour time. So if any of you have time to stick with us, that would be amazing. If not, remember that this will be recorded, and so you will be able to access this information later. Additionally, if we don't get to all of the questions in the Q&A box, we do have your email addresses, and we will follow up with you individually and then share any of that information with the entire participant list. So no worries, keep the questions coming, and we will make sure that we get back to everyone. All right, Dr. Callejas, the first question is, how successful has the faith community been in addressing the opioid challenge?
I think I couldn't say exactly how effective. I haven't seen research that shows, how effective they've been, but I think that they've been increasingly, and depending on what part of the country we're talking about, great partners. Because of the fact that, although it seems counterintuitive, that they are an important resource in a lot of Latino communities and neighborhoods. And they also sometimes have firsthand experience with folks in their community coming to them with health needs or concerns. And so I would say, having had experience, for instance, working with churches to increase awareness of HIV testing and holding events with them, that they're a ready partner for the most part, but that does take some time. So I don't have specifics, like I said, in terms of research, but overall, in general, we find that churches can play an important part in serving as partners to these efforts in a variety of different communities, especially if they're already connected with systems of care, very generally speaking.
Perfect. Yeah, I think that's a really great answer. And so, just remembering that the faith communities are a big part of the cultural protective factors, and knowing that they are an additional place to go to get some of this information, not only on resources, but then also some support. Great. All right. The second question, the data used specifically discusses males and females. Can you talk at all about the data that leaves out those who do not identify within this structure?
Yeah, just a little bit.
Okay.
Part of the reason, I'm sorry, did I interrupt you? Do you have
No, it's okay. So
question?
the follow-up question to that was, who is collecting that data, and where can folks find it? If you maybe don't have, I heard you kind of saying that you don't know that you had the best answer for that. So where might we find that information?
So it's really difficult. I'll have to say that in terms of finding out specific data related to opioid use in particular, not just general substance use, but really opioid use in particular, is still, I don't want to say scarce, but it's, you really have to do a lot of work to find these data. And there are maybe a couple of articles. They're mostly research articles, and unfortunately, they're available behind paywalls that are accessible mostly to academics like me, which is a shame, for making research more widely available. But that being said, as we know that LGBTQ plus youth young adults and adults experience a wide variety of disparities with regards to behavioral health in general, and that the intersection of their gender and sexual identities with their ethnicity, as well as, other factors or social identities can increase the disparities that they experience. And so, I don't have, like I said, I didn't include the data here because I don't have a lot of data in that regard. And I would be happy to help to look for some of that to help the center, increase the access they have to those research articles. But it's, in terms of in the study, I think that I referenced with adolescents who are not referred for buprenorphine treatment, for instance, I believe that included some LGBT youth, but there's not a lot, that shows specific to LGBT Latino youth.
Great. I do want to address a couple of the questions. We've had a couple of questions in the Q&A box about the availability of the recording of this session and the PowerPoint of your slide deck. And so I do want to remind all of the participants that we will make both a recording of this presentation and a PDF file of this slide deck available to everyone. And Dr. Callejas was kind enough to provide all of her citations. So any of the information that she has in here that you would like to follow up on, you can find the citations at the end of the presentation. Let's take a couple more questions. Can you say more about curanderismo or direct us to examples of how this strategy is being used more specifically in communities, or maybe give some reference to some of the states who are supporting the use of culturally appropriate supports in this area?
Yeah, so I think the example that I had that comes most readily to mind would be in New Mexico, where there are, but also some, other states along the border. There used to be, and I don't know if someone can chime in on the chat, there used to be a conference of curanderos who are, traditional healers in a variety of different, from a variety of different backgrounds that, so the thing there is that where you use traditional cultural healers or cultural brokers, they're often referred to, is that folks often have different beliefs that are shaped by their cultural beliefs and upbringing about what causes illness, what causes substance use, and the effects that we see, the negative effects, and what those treatments that one should go to are. So traditionally, the curandero is someone in a community that is a trusted provider, just like a physician or a psychologist, or and sometimes psychologists may not be trusted, right? So the idea is that you have like a dual relationship with the curandero and the treatment provider, and the person that uses that is someone who is an adherent, who believes that that is a legitimate form of treatment for them, but then is coupled with the sort of the traditional substance use treatment that they would get at a clinic, let's say. And that increases engagement because you're sort of making it okay for them to continue their cultural practice of healing that they and their family and maybe their community have relied on for generations, and still allowing for that space within the treatment modality. And that doing that is thought is being shown more and more, or using cultural brokers, other forms of similar to the curandero, to increase engagement into what we would think of as traditional or Western treatment.
Great. Thank you for that. Also in the chat, as you had asked, Valerie Quintana has shared some information on a gathering that happens in New Mexico every July. around this topic. So go out there, look for this information. Another good resource would likely be, looking up your local state's Medicaid services. Some states call them value-added services. Some states call them, add-on services or non-traditional services. I'm sorry, traditional services instead of traditional medical services. And so they would probably have a lot of information about what is offered, what is supported, what could be reimbursed by certain providers. And I think that would even help you delve deeper into what is available in your local states. So to be respectful of everybody's time, we've come close to the end of the webinar. Again, I want to thank you, Dr. Callejas, for all of the information that you provided here. Again, anyone whose question was not specifically answered during this webinar, we will follow up with you and with everybody else with the information that we have contained in the answer. May I please have the next slide?
Sure.
Great. Thank you. So here is some contact information for the National Hispanic and Latino ATTC. Please reach us either at www.nalba.org, or you can reach us at our homepage for the ATTC. You can also reach Dr. Pierre Luigi Mancini or myself directly at our information here. Next slide, please. And here is the information to contact today's presenter. You will have her phone number and her email address and a website where you can reach her as well. Next slide, please. Okay, so I want to thank everybody again for coming to our webinar today. Again, it was titled Understanding the Opioid Crisis in the U.S. Latino Population, Implications and Recommendations. We do ask that you kindly complete the satisfaction survey. Just a friendly reminder that as soon as the webinar is ended, it will immediately redirect you to a SurveyMonkey, and so please fill out that evaluation. We will make a recording and the PowerPoint available to everyone. And please register if you haven't already for our sister TTC's webinar next week on the 31st at 2 p.m. Eastern. Thank you, and I hope everybody enjoys the rest of your day.